Can fasting cure type 2 diabetes? Let's look at a video by Dr. Jason Fung. Welcome back to another Dr. Westman Reacts. If you don't have my top 10 tips on how to start keto right, please look in the description below. Thanks for sending another video for me to react to. Hope you're enjoying these. Dr. Jason Fung, if you haven't heard of him before, is a Toronto-based physician. I kind of laugh because he has a massive internet following, written the books, the Obesity Code, the Diabetes Code, the Cancer Code. So the books are, how should I say, a lot of theoretical and kind of paradigm shifting for you to read. The books that I've been involved in are much more practical and pragmatic and how you do things, get things done. But I've met Dr. Fung a couple times, and his story is that he was a practicing nephrologist, a kidney doctor, and was giving dialysis treatments to people, and kind of woke up and said, why don't we stop the problem that's leading to getting people to be on dialysis, which largely is diabetes and obesity. So he really kind of changed mid-career to be a low-carb and keto advocate, and yet his twist on things was to go toward fasting. And if you've heard of fasting and intermittent fasting, it might be because you heard one of Dr. Fung's videos before. And as you'll see, I think of fasting as a subset of a low-carb diet. It's not what you have to do, but it certainly can work. So let's hear from Dr. Jason Fung himself as he speaks at a conference on what he does.
So the world's oldest dietary intervention, one that's really been used for millennia, in all generations, in all civilizations, in all parts of the world, endorsed by really all major religions, which is free, which is available, also has the power to reverse type 2 diabetes. But not only do we not talk about it, generally, as a physician, we're told to actively discourage this, which is very interesting because I'm going to tell you a story. This is my patient, and he was a 69-year-old man, and I treated him for 15 years almost. Type 2 diabetes, he was on metformin, he was on 160 units of insulin. And so as I learned about intermittent fasting, I said to him one day, I said, maybe you should try this. For 3 days of the week, just eat 1 meal a day instead of 3, all right? So he was very diligent, he did it, and this is what happened. So his insulin dose went from 160 units a day in about a month to 0. And his body weight came down, and his waist circumference came down, and his A1C actually dropped from 7.8 to 7.2. So after about another month, actually he came off all his medications. His A1C was down to 5.9. So by definition, he actually didn't have diabetes anymore.
And I just want to stop and comment that this is what we see in lifestyle clinics. You reverse diabetes, and what's fascinating is that Dr. Fung first got involved in the treatment by using fasting. And so he has incorporated that into his teaching. And the way I got involved with similar stories of patients getting better was using a program that used food. You didn't have to talk about fasting, but it was ketogenic, low-carb dieting. So we both kind of came to this with frustration with our own clinical teaching that we got, and he got into this through the pathway of intermittent fasting. I got into this through the pathway of Dr. Atkins and Dr. Eades and the diet book authors, all the late 1900s. And the fascinating thing is we studied and published papers on what we do, so I've kind of kept that going. And Dr. Fung is talking about a different method, but it has the same end results of reversing diabetes by really just changing the food.
And the problem was that for 15 years, I failed him. I didn't know enough to actually tell him what the proper treatment was. He didn't actually need to have the type 2 diabetes for 15 years. And that's my shame. That's my problem. And that's what we're here to change, to talk about this.
Yeah, and I wish I wish other doctors would wake up to that. And so there are some doctors like Dr. Fung, myself, Dr. Nally, Dr. Wolver, other growing number of doctors actually chronicled in the book called The Case for Keto, written by Gary Taubes. He follows and interviews 100 or so practitioners who use low-carb keto diets. And for some reason, some doctors wake up and realize, isn't there another way to do this? Some of us go back and read the literature or the history like Dr. Fung did and go back to Hippocrates. I have a book that you'll see if you come to my office from the Osler Textbook of Medicine, 1923, where the low-carb keto diet is what the treatment was for type 2 diabetes in 1923. So some of us value the history. We kind of reincorporate that into our current practice. And the information here is now kind of generalized to really any sort of approach, not just intermittent fasting.
And intermittent fasting is not very difficult. They understood a long time ago. Basically, it's energy, right? And if you have, say, a coal-burning power plant, for example, you have energy in the form of coal. We use energy in the form of food. And when you take in food, you can either burn it or you can store it. And there are ways that the body stores energy, or calories, which is sugar, like glycogen. You get glycogen synthesis. And you can store it as body fat, which is de novo lipogenesis, but dietary fat goes directly in. So the whole idea is that if your insulin levels are high, we know from sort of 50, 60 years of research that it inhibits lipolysis. You can't take the stored energy if your insulin levels are high. So that fellow who's taking 160 units of insulin a day, which I gave him, he can't take body fat out and turn it into energy. Because remember, insulin is nothing more or less than, a nutrient sensor. It tells your body, hey, food is available. So you can burn some of it, but you need to store it. But don't take what's stored out. We're trying to put it into storage, so don't take it out of storage. That's all it's telling you.
So to say the same thing, so insulin blocks fat burning. So lipolysis meaning fat burning. If you phrase this in a different way, we have a sugar furnace, a carbohydrate furnace, or a fat furnace. But if you're eating carbs, you have to burn the carbs because we don't store carbs, we store fat. So either your liver turns the carbs into fat and you send it out to storage. So fatty liver actually comes from the carbohydrates in the food being stored changed into fat in the liver and then stored. And then the fat furnace is lipolysis. So insulin, internally, your own insulin or injectable insulin stops your body's ability to burn fat. And this is critical to understanding how, the basics of how our bodies handle fat. You don't want a lot of insulin around if you want to be a fat burner. Technically, weight loss means fat loss. We think in the obesity medicine world, we don't define obesity by BMI, we define obesity by excessive fat accumulation. And we can actually measure that on machines to show you that directly. So this is spot on.
You can't take it out. So if you have too much glucose, if you have too much body fat, as long as your insulin levels are high, you can't take it out. It's only when insulin drops, such as with fasting, such as with low-carbohydrate diets, for example, that your body says, okay, well, no food is coming in. So I am going to need to take what I have stored, in this warehouse and use it. That's all. So in other words, you need to give your body a chance to drop that insulin level so that you can burn the glucose and burn the body fat. And that's really what you're supposed to do. That's why you have the English word break fast. Because every day you're supposed to finish eating and fast. So there's a period of time that you're supposed to eat, insulin goes up, you store energy or calories. There's a period of time you're supposed to not eat, which is fast, insulin goes down, you now use that energy. You don't keep it building up and up and up, which is the big problem. And so recently there's been some trials, and unfortunately it's taken until sort of 2022, but they're starting to come around. So this is an intervention trial in type 2 diabetes where they basically told people for 3 months, plus 3 months follow-up, to do some intermittent fasting. And what you see is that in the placebo group, you had a 2.8% remission rate. In the fasting group, you had a 47.2% remission rate. Almost 50% of our patients don't need to have that diabetes, but it's because we don't tell them that they should do this. And it's nothing more or less than give your body a break and let it burn off all that energy that you've...
I think it's even higher. So in the studies here, they're not necessarily using a low-carbohydrate meal when they're eating a meal. They're just having times when they're not eating. That's the fasting. If you include a low-carb keto diet or a ketogenic framework where you keep the carbs super low and you just eat once a day because you're not hungry, essentially you're getting that fasting period. And that's where I see making you only eat a certain time of day is a second level sort of intervention. I would ask you to just let your body tell you when to eat, not constrain, because there are a lot of different ways to go about this. In the Virta Health study and in our work from, 14 years ago now, the remission rate was even higher for low carb diets. So we're seeing that, yes, now we're getting into different levels of lowering the carbs, and you'll actually get a more powerful effect. The lower you go on the carbs, the lower you go on the calories as well. Yes, low-calorie diets will reverse diabetes as well. It's just hard to stick to them.
Stored away, because that's the natural thing to do. If you've stored too much, you need to burn it off. You don't need to take more. You don't need to eat 6 or 8 or 10 times a day like I had been telling people to do. It's ridiculous. It's the wrong thing to do. And now we have trials that actually say, hey, you know what? That's probably not such a bad idea. This is a much smaller trial, but again, very recent. This came out, I think, in 2022. And it's the same thing. It's called the InterFast trial, and again, a randomized controlled trial on the safety and efficacy. So safety, we actually have thousands of years of data. People have been fasting for thousands of years, so we're pretty sure it's relatively safe if you have enough stores of energy, that is body fat or glucose. And what they found was that you could get remission in 8 patients, this was a small study, versus 0 patients in the placebo group. Again...
Well, I have to say I've always been a bit of a thorn in Dr. Fung's side, just in that we need better data than to say we have the history of fasting to say that it's safe. We also want to know that it's healthy. So obesity medicine specialists like me, like Dr. Fung, we want to use very safe, not life and death danger. We want the healthy ways to help you lose weight or reverse diabetes. So the idea that we don't have clinical trials going forward on intermittent fasting or prolonged fasting in terms of the muscle mass and the making sure that people don't lose lean body mass is a problem for me to be able to advise long-term fasting or certain types of intermittent fasting. There just isn't enough data yet. Now, of course, if you're in the hands of someone who's using this kind of approach and you're directly measuring your own lean body mass, some clinics are able to do that. By more power to you, but we can't make a big policy decision based on the healthfulness or lack of side effects. Certainly, I think life and death is one extreme sort of outcome. We don't want to be anywhere near that in terms of obesity medicine and diabetes reversal. Weight loss surgery can go to diabetes reversal and weight loss, but there's a mortality associated with weight loss surgery. So I don't want to be anywhere near mortality or extreme severe side effects or adverse effects. I want to be teaching people a healthy way of doing things without common or without really any loss of lean body mass if possible.
A very important result, because these patients don't have to have type 2 diabetes. And of course, you look at this interfacet.
So if you've been watching my videos, I like to teach a little bit about the methodology, about science and how we make decisions. You can show that something works with 8 people or 20 people, but you can't really comment on the safety of it. There's a old number, 3 over n rule, n meaning the number of people in your clinical trial. 3 over n is the upper 95% confidence limits on something that didn't happen. So let's say you have 1 person in your clinical trial, okay, that's not 10 people in your clinical trial, 3 over 10 is 30%. If you have 10 people, you follow them, you still may have a 30% mortality because you haven't done enough people. It's kind of like rolling a dice. You might be able to roll 1 or 2 or 3 or 4 at the same number at a time, but after a while you need higher numbers to be able to see the bigger view of it. So if you have 100 people in a clinical trial or any kind of treatment and you don't see any outcomes or negative events, it still could be 3 divided by 100, 3 over n. It could be up to 3% mortality because you don't have all that many people to be able to comment on mortality. This is just a kind of a statistical shortcut. So if you have 10,000 people in a clinical trial, 3 divided by 10,000, you have 100,000, you're following them. This is one way that the governmental agency, the Food and Drug Administration, why they require a certain number of people. Well, there's no exact number, but you need to get thousands of people on a medication without terrible things happening before they'll approve a medicine for widespread use. And so, and even when you go from thousands of people on a diet or on a medicine, then you give it to 1 million people in the general public after it's approved, even more things are learned about the method of fasting or a drug treatment. So that's called phase 4 marketing, or following the medicine after it's released. Right now we're watching the massive release of this molecule called semaglutide that's in pills and shots and daily shots and weekly shots, and so as the number of people exposed to it, because they're now approved, these medicines, we're learning about side effects that were not seen in the original clinical trials because they didn't happen at a rate that was high enough to be seen. But once you put it into more people, you'll find out these things, which is one reason why I'm not a big advocate of using medications for the treatment of obesity or diabetes reversal, because we can use lifestyle instead of these medications. And these medicines, while they can be useful for many people, are not the only way to go about it.
Fast 2 trial, and you see, the A1C changes are plummeting in the fasting group, which is sort of exactly what you would expect to see. If you look at the number of people getting reductions of insulin, 75% of people are going to reduce their insulin needs. Well, that's just logical, right? If you have a car and you go to the gas station and you fill up 3 times a day and you're pumping gas in, now the gas tank is full, but your doctor says keep pumping. So you keep pumping and the gas is flowing out into the back seat, you're getting sick. What's the first thing you're going to do? Stop going to the gas station. That's all an intermittent fasting is doing. It's so bloody logical. I don't know why we don't talk about it. But when we do, the results are just stunning. Like unbelievable results to, me 10 years ago before I actually learned about it. This is another trial, again, 2022. So we've just recently been starting to talk about this, another randomized controlled trial. And again, what you see is in here, the intermittent time-restricted eating, which is the intermittent fasting group. Again, a significantly lower level of glucose. So I don't have a lot of time, but I'm going to just talk about the physiology, because it's been worked out for, again, 50, 60, 70 years. What happens when you don't eat? And this was the classic study, and it basically shows you where blood glucose comes from. It tells you, it breaks it into sort of 5 stages of fasting. In stage 1, you're eating, so you're getting exogenous glucose, which is, you're eating food, your body is saying, okay, I'm going to use the energy that I'm using. That's great. When about 4 or 5 hours afterwards, there's no more food, so then you break down glycogen. So glycogen is just a long string of glucose. It's in the liver. Your body then takes that glucose, chops it up, throws it back into the system for you to use as energy. At some point around 12 to 16 hours, you see there's a bit of a change. Glycogen starts to run out, and you get this period of gluconeogenesis, where you're using a bit of protein. And that's not necessarily muscle. There's a lot of excess protein in people who are overweight. It's estimated about 50% of the obese people have about 50% more protein. That includes connective tissue and skin and all this sort of stuff. But then after a certain period of time, the gluconeogenesis starts to go down, and you basically power yourself on body fat. Again, pretty logical. Your body stores energy as glucose and fat. When you don't have food, your body uses the glucose and fat. And that's all it is. That's all body fat is a store of energy. So let your body use it. Instead, we try and come up with all these complicated things and say...
Well, I simplify things in my teaching that I really don't mention glucose as a major source of fuel. That's not what you're trying to lose when you're trying to lose weight or reverse diabetes. You're trying to get rid of the fat. So we store energy really mainly as fat, and we're trying to get that fat burning. So I don't want to complicate it by adding in the glucose store. The glycogen is really pretty irrelevant. And it occurs to me now, I remember this, I've seen this figure from the paper years ago, that it was among carb eaters. Because here you have someone eating the glucose going up after the meal. If you don't eat carbs, you don't get this kind of response, and your blood sugar remains fairly stable because it's being addressed not by the food going in, but by a hormone called glucagon that keeps the blood glucose very stable. So actually this figure will look a little different if you're not eating carbs. In fact, you might be wearing a continuous glucose monitor, a Dexcom or a Libre, a CGM, that shows you that your blood glucoses are like this until you eat carbs and it goes up like this. And I think these tools are very useful. They're not necessary, but you can actually see how your glucose changes. You don't have to rely on a paper from some years ago, but this is the basic response. You don't worry about the blood glucose. Now, if you're shifting to ketones and fatty acids as the major source of nutrition, this glucose level becomes less important.
Why are we getting too much? Well, you put too much in storage because you told your body through high insulin levels to store more. So your body stores more. People talk about causality of obesity. Well, if you have something which causes another thing, you just say, okay, if I give this thing, does it cause obesity? If I give insulin to people, does it cause obesity? Absolutely. We've known that for hundreds of years. Every single patient of mine tells me that. And yet we still argue about what causes obesity. Well, I'll tell you what causes obesity. Insulin. I give insulin, they get fat. I can make anybody fat. I can make Ben Bickman fat. I can just give him insulin, and he will get fat. So that's called...
I have to just echo what Dr. Fung is saying, and what you're hearing from me, from Dr. Fung, is the voice of doctors who've been in a clinic, who are currently in a clinic, and seeing this happen, and that credibility or that the reputation and actually the experience is invaluable, because I can't really find research studies to support everything I do. In fact, we're so far ahead of research studies that there are people backfilling science, funded science, because they're learning from what we're finding in the clinic. So letting your body burn its own fat, you've already stored a lot of fat there. Part of what we're dealing with is that the inability of some people to stop consuming the food that leads to the insulin level, that leads to the fat storage, that leads to the type 2 diabetes. And it's a food issue that leads to this metabolic problem.
Causality. Don't make it more complicated. It's basically fasting is a way to switch from using all your glucose to using fat, because that's the way your body stores it. When you don't eat, other hormones go up. Again, medical school physiology 101, you have counter-regulatory hormones. Sympathetic nervous system goes up, adrenaline goes up, growth hormone goes up, cortisol goes up. Again, they take because you're not having glucose, exogenous glucose, your body's sort of pushing it out. So what happens over time with the metabolic changes, this is 4 days of fasting. As the body weight comes down, the resting energy expenditure, that's how many calories you're burning in a day. On day 0 is 39.7. Day 4 of no food, it's up to 44. So your body has increased its energy expenditure by 10%, even while it's not eating. Why? Because the hormones told it to. The noradrenaline went up, growth hormone went up. It says, push more glucose into the system, and that's basically what it does. Growth hormone, after 5 days of fasting, goes up like 5-fold. We've known that. This was a study from 1988. Not that difficult. And for, this intervention that we've used for thousands of years, there's so many advantages. It's simple. You could just tell people, just don't eat for this period of time. Calorie restriction is not the easiest thing. You have a piece of salmon, it's like, well, did you cook it in butter? What did you add to it? Did you marinate it? Like, it's very difficult to figure out how many calories are in that piece of salmon. It's very easy to say, I did not eat from,
I love this part of how simple fasting can be, meaning not eating.
6 p.m. till 6 a.m. And if I want to say, just go longer, you can. And sometimes people say to me, well, people won't do it. It's a great intervention, but people won't do it. And I always respond, well, my job as a doctor is not to tell people what they can and cannot do. My job is to tell them how they're going to get healthier. If we give people chemotherapy and give them all kinds of crazy surgery, they'll do it. And you're telling me they won't just not eat for a little while to reverse their type 2 diabetes, to prevent cancer, prevent heart disease, and all those other things? You can use any diet. So low-carbohydrate diets are great, but you don't have to use it. I think that it works well together. But you can use it with any diet. In fact, it has been used with every other diet. All over the world, in all times.
My experience, exactly. If you tell someone that they can reverse their diabetes by changing the food or not eating here if you're doing fasting or just not eating carbs, suddenly the motivation changes, and most people have no idea that their diabetes can be reversed. And once you learn that, you actually get the motivation to be able to do something relatively simple.
In history, it's free. So GLP-1s are great. They're not cheap. This is free. And it's convenient. You can do it whenever you want. You can, if you don't eat, you don't have to shop, you don't have to cook, and you don't have to clean up. So you're saving a lot of time. So it's very convenient.
People complain about diets, the expense, it's so expensive to do a keto diet. No, it doesn't have to be. You can do it with inexpensive foods. It doesn't have to be super clean, organic, expensive farmers market kinds of stuff. The other funny thing is that if you don't eat at all, you're not spending any money on the food. So you can do it anywhere, right? But I do encourage people to eat when they're hungry and not use a time-delimited intermittent fasting window to begin with. If from within you don't want to eat, you're not hungry for that period of time, I think that's just fine, which is just a little nuanced difference from doing fasting as learning I need to not eat here. The other difference is that Dr. Fung is using that meal, the one meal a day, and doing different kinds of diets within there. I would recommend only using a low-carb diet in addition with the intermittent fasting. It's just what I'm comfortable with, what I'm used to. And actually, I think we get better results, although there's been no head-to-head trial of low-carb ketogenic versus intermittent fasting, higher carb. And I don't know that will ever be done.
And it's flexible. This is the way people used to do it. You're not fasting all the time. You're not feeding all the time. If you have a period of time, like Christmas or a holiday, you go on a cruise, yes, you are going to eat too much. I do it, everybody does it. The point is that I don't have to fast while I'm on my cruise. I don't have to be that guy who won't eat that and is like, oh my God, like, what are we gonna do, right? You can fast later on and make up for all the food that you ate. It's okay. That's how you did it. You feasted and then you fasted. That's the natural cycle. And really, the conclusions are very simple. Like, I hate when we overcomplicate things. When you're eating, you're going to store calories, right? Insulin goes up, tells your body, calories are coming in, energy's coming in, You need to store some of this because if you don't, you'll die, right? If you have no ability to store calories, you will die in your sleep because you have no energy. So that's what we do. We store calories. When you don't eat, you burn that calories. That's all it is. So fasting simply allows your body to use the stores of energy, and that's all you're talking about. If you have excess glucose, which is a source of energy, then this intervention could be very good for you. In fact, it could save your life. Thank you.
Dr. Fung's presentation style is awesome. If you get a chance to hear him, please let me know what you think down below. And if you like this, please like it and subscribe so you don't miss out on further videos. If you don't have my top 10 tips on how to start keto right, please look in the description below. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.